Dr. Sajid here again. I do get a little bit of feedback from parents who look at some of my video clips, and I've been asked to talk about problems of the ear, nose and throat. So we'll talk about ear problems today and see if we can cover the rest in the coming videos. Now the ear, as you see it, is actually just one part of the ear. It is what we call the outer ear, and there are actually three parts to the ear. The outer ear as you see it, and along with it there is a canal or a tube that runs from it, and it ends in a place where the middle ear begins, and there is a membrane or a partition that we call the tympanic membrane, and then beyond this is the internal ear, so it becomes three parts. Now when you look at the ear, at least if you're a pediatrician, then there are a number of things that you notice. It's the shape and the size and the form and the cartilage, which is the hard part of the ear. And this becomes very important when you are checking a newborn baby. For example, premature babies will have very little cartilage, with the result that if you fold the ears of a very premature baby, it will stay folded. As the baby matures and is full term, carries to 40 weeks of gestation, then the baby will have more cartilage, and even if you fold the ear, it goes back to its normal position. Sometimes we look at the position of the ear, and if it's very low, and if there are any problems, then it may be associated with some internal problems, and that is for the doctor to decide. For you have to remember that one of the commonest problems that we see in infants is a rash, which usually is behind the ear, sometimes a little wet, and sometimes it is irritating, and this can be because of dermatitis or inflammation of the skin that comes from the head, or what we call seborrhea, and sometimes it may be an allergy, and the doctor may prescribe some medicine for it to apply. The other problem that we see often in the ear is the presence of wax. Now this is a material that is formed there, and it keeps anything from entering the ear, and it brings it out actually, and so does the wax. The wax comes out. So we don't need to put anything in the ear to pull it out or to drag it out. As a matter of fact, we don't recommend that you put anything in the ear, and especially no Q-tips or cotton buds as they're called, because that will just compress the wax and make it hard. So let it come out. When it does come out, then of course you clean it. Only in very special instances, if the wax becomes very hard, then the doctor may prescribe some medicines. Also, there is an ear infection, in which case there will be not only pain, but some sort of a discharge coming from the ear, and this will also require the ear to be treated, mostly by keeping it clean and some antibiotic drops. Now, beyond the canal and the tympanic membrane is the middle ear, and it has a little bit of a fluid in it, but that fluid then drains from the ear down into the throat, and this is done by a tube that is called the eustachian tube. So this, as long as this fluid is draining, everything's normal, and the baby's or the child is fine. But if this fluid gets accumulated, or this tube that I'm telling you goes from the ear into the throat gets blocked, then fluid builds up, and this is what we call the middle ear infection. And it can be just fluid, or it can actually become infected and become like an infection. So in both instances, the child may have difficulty in hearing, may have some discomfort, and especially in the case of an infection, it might also produce fever and a lot of discomfort. So this may require medical treatment, and if your child has a constant problem with fluid in the middle ear, or it stays for a while, it becomes chronic, then sometimes surgical drainage may be necessary. Which brings us to the third part of the ear, which is the inner ear, and that has to do with the very important function of balance of the body. So if you have any infection in the ear, sometimes a child will be a little unsteady, may lose his balance, and of course the hearing may be affected. Now the hearing may be affected also by a canal that is blocked by wax or by an infection. It may be impaired by fluid in the middle ear, and it might be affected by infection which is beyond this in the internal ear or the third part of the ear. So the child is quite unsteady, loses his balance, and of course hearing may be affected quite a bit. So the ear, which is a part of the ear, nose, throat, is an important organ, and in some future date we'll talk about the impact on hearing and what to do. I will also talk about the nose and the throat problems in the coming video. I hope that this will be of some use and some information to you.